video, we're going to be reviewing how to know when there's an emergency and what to do if you find one. Please watch the emergency preparedness video prior to watching this video so that you're prepared if you should encounter one of these scenarios. Preparation is key, so at the beginning of every shift, make sure you have your safety equipment ready to go. Have your resuscitators or baggers ready, one at the bedside and one on the wheelchair, and check them both at the beginning of every shift to make sure they both hold pressure. I'll have 2 spare inner cannulas ready to go, one available in my ready-to-go bag on the back of the wheelchair. I'll have 2 trach tubes, one is a size 6, this is what the member is currently using, and one size smaller, a size 4. I'll go over why we need that later on. My suction equipment is ready, and I have tested it. The suction canister is empty as well. I have my cell phone, so 911 is easily accessible, with the member's relatives and doctors pre-programmed. Always have your phone on you so you don't have to leave the member in an emergency to get help. I also have a spare emergency 6-foot circuit with exhalation valve and trach connector. The bagger is the most important piece of safety equipment. It's important you get comfortable with the bagger. Practice with the member before when they are healthy and well. Knowing how it feels to ventilate them when they're healthy and well is a great troubleshooting tool to help determine if the issue is with the member or with the circuit and the ventilator. How do you know if a member is in distress and needs your help? No voice means no air. If they can previously speak with you and suddenly can't, this means they don't have air. Ways for the member to get your attention without having air would be with different noises with their mouth. Examples are tongue clicking or lip smacking. They might try and get your attention by activating alarms on the ventilator or with an external call bell system. These examples are ways to get your attention if they are unable to make sounds. Look at their face. You may notice that they are pale or dusky, sweaty, eyes may be wide open, or they may be blinking rapidly at you. They may also try to run into you with their wheelchair. There will always be indications that something is not normal and that there is something going on with them. It is very important to have a discussion with the member and to find out what they'll do to get your attention if they need your help immediately. Never delay in responding to an alarm, external or ventilator, and never leave the member until the situation has been resolved. If the member is actively trying to get my attention and not able to vocalize, the first thing that I'm going to do is disconnect them from the ventilator and attach them to the manual resuscitation device or bagger, and start bagging them immediately. If the member starts talking to me, I know the problem is with the ventilator circuit or ventilator. The member is doing fine now that ventilation is restored. Because this member is ventilated 24 hours a day, I'll place them on the wheelchair ventilator so I can troubleshoot the bedside ventilator and circuit. There are 2 types of alarms, high pressure occlusion alarms or low pressure disconnect alarms. I will start troubleshooting my circuit. I'll start at one end of the circuit and walk my hands all the way to the other end, looking for issues and resolving them as I find them. I'll start at this end and make sure the connections are tight, and run my hands along the circuit, and oh, here I find there's a hole in the circuit. I've determined there's a leak here. So I'll change this piece to hopefully resolve that issue. Next, I'm going to examine the water trap and make sure the cap and cup are connected tightly together. Here, I find water condensation accumulated in the circuit. This can cause a high pressure occlusion alarm. I'll dump all water back towards my water trap. Let's finish by walking our hands all the way back to the exhalation valve and up to the flex tube. I've addressed all the issues in the circuit, so I can now complete a circuit test and try the ventilator back on the member. Once reconnected to the ventilator, if the situation is resolved, then great. If not, try taking a brand new full circuit out of the package and attach it directly to the ventilator. If this still doesn't work, call PROP and speak with a registered respiratory therapist. They'll be able to assist you further and troubleshoot with you because the issue may be with the ventilator itself or with the exhalation valve and associated wires. Let's say I had started to ventilate with the bagger, but I was not able to ventilate like normal, and they were still not able to vocalize. Then I know the issue is with the member or the trach tube. The first thing I'll do is remove the inner cannula and replace it with one of the spare ones that are already at the bedside. I'll pull out the inner cannula, and sure enough, it's full of secretions. I'll put in a new inner cannula and click it into place, then start bagging right away. The bagging feels much easier, and the member is able to vocalize a little. If the inner cannula was completely occluded with secretions, chances are that the member will need a suction. Place the member back on the ventilator and get ready for a suction. Because this is more of an emergent scenario, I'll glove my dominant hand and forget about hand washing just to get on top of the secretions. My non-dominant hand can touch everything except the suction catheter. I'll reattach them to the vent and check back in with the member. They may need another suction. You can repeat suctioning steps until the airway is clear. If the ventilator is alarming and the member is trying to get your attention, you may see something like this. The inner cannula was not twisted and locked into place properly. This will cause a low pressure disconnect alarm after approximately 15 seconds. It's important to set the low pressure alarm correctly so that you are alerted if this situation occurs. Pull out the inner cannula and reinsert. Make sure that it's locked into place and reattach your member to the ventilator. Or you can grab your manual resuscitator and start bagging them. If this resolves the issue and the member is fine, then the situation has been resolved. Worst case scenario would be a complete trach tube dislodgement. The low pressure alarm will be sounding on the vent. We recommend taking the tube and reinserting it back into the stoma and then reattaching the posy ties. If this has restored ventilation and the member is feeling fine, contact their physician right away to find out if antibiotics are indicated in this situation. If the member has a lot of independent breathing time, you may be able to grab a brand new sterile tracheostomy tube to insert back into the stoma. With a trach tube dislodgement, swelling can occur around the stoma, which could mean the number 6, the current trach size that the member is using, will not fit back in. This is why every member has one size smaller tracheostomy tube to use in this type of emergency. If this is the case, go to the hospital and have the member monitored until the swelling goes down and their regular sized trach tube can be reinserted. Have a conversation with the member prior to any emergency. You want to know if the tracheostomy tube can be put back in or if they are more comfortable with a sterile tube. If you are ever uncomfortable or need a spare set of hands, or if you ever find the member unconscious, call 911 right away. If any of the interventions that you're doing are not helping the member, call 911. You need assistance. Never leave the member in this situation. If the member has to go to the hospital with paramedics, please go with them. You know the most about their medical history and the ventilator. In summary, always be prepared. Always check your safety equipment well beforehand. Know what normal ventilation feels like for the member. Remember, no voice means no air, and the member needs you right away. Use your bagger. Use your bagger to determine if it is a member-related or mechanical issue and resolve these as best as you can. If you're ever uncomfortable or need help, call 911.